hospitalized with bird flu also wasn't known to have had contact with infected animals. So is there a relationship here between bird flu, cattle-related illnesses, and then the human transmission?
Yes, there is. So a couple things that were notable about that teen in Canada. One, again, we don't know the source. Two, that teenager is critically ill. So this is not a mild case of bird flu like we've seen with other bird flu cases. And three, we've seen mutations in that particular case that would make the virus more easily transmitted from person to person. But big picture, we're seeing bird flu spreading among poultry, wild birds, cattle, humans, and this is really Russian roulette for creating a situation where you have mutations for adaptation to human transmission.
Could we be in a situation where we're facing another pandemic or one that changes our lives?
Well, that's precisely what we're worried about. The two things that we worry about here are, one, the human-to-human transmission piece. The other is a virus to which we don't have pre-existing immunity. So think back to COVID in 2020. We're in a very different world today. But at that time, it was a new virus to which we had no pre-existing immunity. And that's why we worry about animal viruses that we have not developed immunity to before.
Some random breaking news. So for the first time in U.S. history, the bird flu was confirmed in a child. The Center for Disease Control came out today and confirmed this case was in California. The case was originally detected via influenza testing and then immediately reported to the California Department of Public Health. So far this year, there have been 55 total reported cases. 29 of them have been in the state of California. And the child is recovering well. The report had mild symptoms, so that's also really good to know. Also, it's really good to know that there is no confirmation of person-to-person transmission of the bird flu in the U.S., so that's great. And the CDC remains the fact that the risk assessment for that is low right now. Though they did state that if you are in contact with those types of animals, often you do have a higher risk. So follow along, more breaking news to come.
To the index now, the CDC confirming the first human case of bird flu in a child here in the U.S. Health officials say the infected child lives in Alameda County, California. The child is being treated for mild symptoms. There's no evidence of person-to-person spread. They're still trying to figure out how the child was infected. Health officials say the risk to the public remains low. And a nationwide egg shortage may be linked to bird flu. Heading into the holiday season, the Department of Agriculture expects cases will keep hurting the egg supply and raising prices into next year. The average price for a dozen eggs is now $3.37. That's up 30% from last year.
2 chickens at a live bird market in San Francisco tested positive for H5N1 avian flu last month, authorities announced Monday. The San Francisco Department of Public Health reported that state health officials discovered the infected, asymptomatic birds during a routine monitoring program conducted by the California Department of Food and Agriculture. The testing comes amid the current national bird flu outbreak. The most important thing to note is there's no threat to public health at this time, said Dr. George Hahn, the Director of Communicable Disease Prevention and Control at the San Francisco Department of Public Health. There have been no human cases. Health officials said they closely monitored the market employees who had contact with the chickens. Over 10 days, none of the employees reported symptoms. No public exposure occurred. And the market located in the city's Bayview neighborhood has since reopened safely.
No, don't say that.
Bird flu alert, 53 cases. Human cases of H5N1 bird flu in the United States have reached 53 as of November 2024, confirmed by the Centers for Disease Control and Prevention. Most of these cases are linked to exposure to infected dairy cows, specifically in California's Central Valley, affecting over 50 dairy herds. Workers on these farms have been the primary individuals impacted, generally reporting mild symptoms such as conjunctivitis and upper respiratory issues. The CDC reassures that, despite the increase in cases, there is no evidence of the virus spreading from person to person, and the immediate risk to the general public is considered low. Efforts to control the outbreak are underway, with the CDC working in conjunction with state and federal agencies and animal health officials. This collaborative effort is part of a One Health approach, focusing on the intersection of human, animal, and environmental health. In affected areas, stringent biosecurity measures and surveillance are being implemented to prevent further spread. Farmers and workers are advised to follow safety guidelines to minimize risk, including the use of protective gear and regular health monitoring. Public health officials continue to emphasize the importance of reporting any unusual symptoms or potential exposure to healthcare providers promptly. This vigilance is key to ensuring the outbreak remains contained and does not pose a wider threat to public health.
There have been some really interesting developments with bird flu. As some of you may know, the reason egg prices have been increasing is because a lot of poultry populations have had to be culled in order to mitigate the bird flu crisis. But over the past few months, there have been 53 confirmed CDC cases of bird flu among people, which means that bird flu is now transferring from animals to people. But now there are 2 younger individuals, a child in California as well as this child in Canada, that have contracted the disease, but nobody knows where they got it from. There have also been mutations in the H5N1 or bird flu virus that have shown it is now being more penetrating when it comes to your airways. Before, there used to be just minor symptoms with the majority of people that have gotten bird flu so far. Now it's getting worse. While there's no confirmed cases of human-to-human transmission at this time, we need to really be vigilant when it comes to interacting with wild birds, poultry birds, or even cattle. According to the CDC, it's spreading from poultry, cows, wild birds, even cats. Domesticated cats have been reported to now be receiving bird flu as well. Mammals in general, which namely it's cats, it's just sporadic, and so is poultry flocks, but with poultry flocks, it's been enough where egg prices have been impacted by this. What's also really crazy about this, and if you stuck around this long, thank you, because here's what's really alarming. Now they have discovered cases in Hawaii, which is an island, okay? So the bird flu is going from mainland United States to Hawaii, an island or a group of islands. So that means either birds are traveling there or people are traveling there. So there's definitely going to be more developments coming, so please look out for developments.
Hey, Dr. Cat, epidemiologist. I've had many requests for a deep dive on the status of bird flu, so I'm going to tell you everything I know as of right now. So as you know, H5 bird flu is widespread in wild birds worldwide, but is causing outbreaks in poultry and dairy cows in the U.S., with several recent human cases as well in U.S. dairy and poultry workers. So I'm showing a map above my head that quantifies the number of dairy farms that have been involved in this outbreak in the U.S. Don't drink raw milk. But in addition to cows and poultry, it has also been found in cats, goats, alpacas, skunks, house mice, and most recently a backyard pig in Oregon. Now, pigs are of particular concern because they can act as mixing vessels for both avian and human flu viruses, potentially recombining and creating new, more virulent strains. There are some cases in humans. The current strain that's circulating in dairy cows and poultry has caused only mild or asymptomatic infections in the U.S. in 53 workers, dairy and poultry, and I'm showing a graphic over my head of the breakdown of the states and which ones were dairy and which ones were poultry workers. But however, the CDC just published a study that was done in Colorado and Michigan showing that 7% of dairy farm workers exposed to H5N1 actually had antibodies, many without ever having symptoms. So this study revealed that we definitely have undetected cases of bird flu in humans. There is a Canadian teenager that was critically ill or is critically ill in British Columbia that was infected with H5N1. The source of this teenager's exposure is currently unknown, as they did not have any contact with poultry or dairy cows, but did have contact with other types of animals like cats, dogs, and reptiles. Importantly, the genetic sequence of the teenager's H5N1 bird flu virus showed that that virus had undergone mutational changes that made it easier for that version of the virus to infect people. It does not, however, appear that this teenager infected anybody else. New as of yesterday is that we have a possible bird flu case that was identified in a child from Alameda County, California, with upper respiratory infections. This child was treated and is recovering at home and has had no contact that is known with infected animals, but may have been exposed to wild birds. Initial testing did show low levels of the H5N1 virus, but these were so low that it suggested the child was maybe not infectious, and follow-up tests to the virus were actually negative. Specimens have been sent to the CDC to confirm that this is for sure a case. Family members and contacts have been negative as well. So the last thing I wanted to mention is that there was a preprint study. This is not peer-reviewed data, but it shows that older folks have a higher level of antibodies that recognize H5 viruses. And this is probably due to previous exposures compared with younger individuals. So younger individuals would probably benefit greatly from a vaccine if we were to have some kind of person-to-person spread situation. The key takeaway here is that the current risk to the public of H5N1 is still deemed to be low per the CDC, but influenza is unpredictable and public health officials are definitely monitoring the situation, and I will keep you updated with any more developments as I hear of them.
As bird flu cases rise across the United States, many people are asking, could we be facing another pandemic and lockdown with dozens of people already infected in 2024 and a teenager in Canada now in critical condition? The question is becoming more urgent. Should we be worried? Let's take a closer look at what bird flu is, how it spreads, and why you probably shouldn't worry, at least not yet. Bird flu, also called avian influenza, is a virus that mostly spreads among birds. It's caused by a group of flu viruses, some of which can be dangerous to both birds and humans. The strain causing concern right now is called H5N1. While bird flu mostly affects animals, there have been a few cases where it has jumped from birds to humans, especially people who work closely with infected animals, like farm workers or poultry handlers. In fact, farm workers in California recently tested positive for the virus, though they only had mild symptoms, such as red eyes and flu-like aches. No one required hospitalization, according to the Centers for Disease Control and Prevention. A child in Northern California also tested positive for bird flu, but the situation is a bit confusing. This child had no known contact with infected animals, which makes the case more unusual. Health officials are investigating if the child might have been exposed to wild birds. Fortunately, the child is recovering at home, and further testing showed that they were also positive for other viruses like the common cold. Even though it was a low-level detection, the CDC is still investigating just to be sure. So, can bird flu spread easily between humans? The short answer is not right now. Unlike COVID-19, which spreads quickly from person to person through the air, bird flu mainly spreads from animals to humans and requires close contact. There have been no signs of human-to-human transmission, which is crucial for a virus to spread widely among people. In the case of bird flu, most human infections have been isolated, often among people who work with poultry or farm animals. While bird flu isn't spreading from person to person right now, scientists are keeping a close eye on the virus because each new human infection gives the chance to change. This is where it gets a little concerning. If bird flu mutates and begins to spread easily from person to person, that's when it could become a bigger problem. And as winter approaches, a time when respiratory viruses tend to spread more easily, researchers are monitoring the situation carefully. Despite the growing number of cases, experts agree that the risk to the general public remains low. The CDC has said there's no immediate threat, and while bird flu can cause severe illness in birds and even in humans in rare cases, it's not currently a major threat to most people. The virus is primarily an animal virus, and right now the number of human cases is still low. However, scientists warn that some things could change, and that's why they're watching closely. Bird flu can cause symptoms like red eyes, sore throats, and body aches, similar to the flu. In severe cases, it can lead to pneumonia or even death. In some parts of the world, bird flu outbreaks have caused the death of large numbers of birds and even people. And in fact, the cost of fighting bird flu has been in the billions, as governments have to cull millions of infected birds to stop the virus from spreading. For now, experts believe a bird flu lockdown is unlikely. The virus has not shown the ability to spread easily among humans, so a large-scale outbreak is not expected. But as we've learned from the past pandemics, it's always good to be prepared. Health officials will continue to monitor the virus, especially as we head into the winter when respiratory viruses are a little bit more common. For now, though, the risk to most people remains low. So, could a virus that mainly affects birds adapt to spread from person to person? Only time will tell. But for now, there's nothing to worry about.
To the to the black lady's question at the end of the video, yes, and yes. People should be worried. People who say, is there going to be another pandemic? Yes, it is. The people who are afraid that there's going to be another lockdown, yes, there is. Um, Things are getting out of control if you really pay attention to everything in the news or just in your local area. Okay, this this is very serious. It may not be very serious for you, but I'm looking at it like holy holy smokes. If there's already cases in Canada and then there's one in California, okay, and now it's spreading worldwide, and now they're telling you eggs are going to go up because of the bird flu. And then they saying, oh, now it's in the dairy products and now in the cows. Haven't they been trying to kill cows since what, 2020? You know, they've been trying to kill all the cows, and now it's the cheese and the yogurt and the milk and this and that that's giving people what they call bird flu. We don't know for sure what's giving people the bird flu, but a lot of people say don't panic. And I agree, don't panic, just be cautious, right? And but in my opinion, people should be aware that a pandemic is coming and a lockdown is coming because of all these, how can I say it? Uh, Diseases or illnesses from the past are coming back, right? So they're going to want to try to lock you down so it won't keep spreading or keep, what they say, evolving, right? They thought that mess with COVID, nah. People got scared with COVID, and COVID wasn't really nothing, honestly. But yes, something's going down and it's coming down the pipeline. So those who know in their head that there might be a lockdown coming, they should start getting ready while other people are panic buying and stuff like that. So so they're getting ready. And it's just a warning if you can read between the lines. But what do I know? I'm just a talking head. Have a good day, YouTube.